The lymphatic system is an essential part of the human body's immune system and circulatory system. It consists of a network of vessels, nodes, and organs that transport lymph, a fluid containing infection-fighting white blood cells, throughout the body. Here's a breakdown of its components and functions. Components. Lymph, a clear fluid containing white blood cells, especially lymphocytes, which are key in immune responses. It circulates through the lymphatic vessels and is collected from tissues. Lymph vessels. Similar to veins, lymph vessels carry lymph through the body. These vessels contain valves to prevent backflow and ensure lymph moves in one direction toward the thoracic duct or right lymphatic duct. Lymph nodes. Small bean-shaped structures located along lymph vessels, primarily in the neck, armpits, groin, and abdomen. They filter lymph and trap pathogens such as bacteria and viruses. They also produce and store lymphocytes. Lymphatic organs. Spleen. Located on the left side of the abdomen, the spleen filters blood and removes old or damaged red blood cells. It also stores lymphocytes and helps fight infections. Thymus. Located behind the sternum, it is where T cells mature and become part of the immune response. Tonsils located in the throat. Tonsils act as the first line of defense against ingested or inhaled pathogens. Tissues. Lymphoid tissues, such as the mucosa-associated lymphoid tissue, MALT, are found in places like the gut and respiratory system, where they help fight infections. Functions: immune defense. The lymphatic system is crucial for immune surveillance. It transports immune cells, like lymphocytes, to sites of infection and inflammation, helping to neutralize pathogens. Fluid balance. It helps return excess fluid from tissues to the bloodstream, maintaining normal fluid balance in the body. Absorption of fats. The lymphatic system absorbs fatty acids and fat-soluble vitamins from the digestive system and transports them into the bloodstream. Relevance to healthcare providers. Swollen lymph nodes, often a sign of infection, malignancy, or inflammatory conditions. Healthcare providers may observe swollen nodes during assessment, especially in the neck, groin, or armpits. Lymphatic obstruction. Conditions like lymphedema, swelling due to lymph fluid buildup, or lymphatic obstruction can be seen in trauma or post-surgical patients, for example, after cancer treatment. These require attention to ensure proper fluid drainage and prevent further complications. Sepsis. The lymphatic system plays a role in fighting infections, and in cases of sepsis, the system can become overwhelmed. Recognizing signs of infection early can help healthcare providers administer treatment quickly to prevent worsening conditions. Assessment and treatment. Healthcare providers may need to recognize signs of infection, trauma, or inflammation affecting lymphatic structures. Swelling, redness, fever, and pain around lymph nodes or organs like the spleen can indicate serious conditions like infection or rupture. For example, splenic rupture in abdominal trauma. Understanding the lymphatic system helps people in the medical field better identify potential sources of infection or immune system dysfunction, enabling appropriate interventions.